some off the color comments probably.
Thank you for joining us, everyone. I'm Steve.
And I'm Scott.
Welcome back. Together we are Backyard Musings.
Yep, and we are talking about one of my most favorite foods today.
Kimchi. So we just had one of our good friends, their son, just came back from a mission in South Korea. Days ago.
Yeah.
And on Sunday, he told me that he loves kimchi. So here we go.
Good for him.
Research shows that eating fermented kimchi can help improve fasting glucose, lower triglycerides, and reduce high blood pressure. Researchers at the College of Agricultural Health and Natural Resources conducted a review examining the health effects of kimchi, a traditional Korean dish that has seen rising popularity worldwide. Pinball, he makes kimchi. I've seen him make it, and he's put it on his show that he's made it.
Nice.
The research was published in Nutrition Reviews on November 14, 2024. Would you like to know more?
Okay, here we go. Kimchi is typically prepared from fermented cabbage and radish, seasoned with salt, chili powder, garlic, and ginger. Although it was once relatively uncommon in the United States, it is now widely available in many grocery stores across the country. This review summarizes findings from existing studies on the health benefits of kimchi, making this information more accessible for researchers in the United States. The project was led by Seong On, I don't know if I'm pronouncing that right, a postdoctoral researcher from visiting scholar in the lab of Ok Chong, professor of nutritional sciences, and interim associate dean for research and graduate education.
So, Scott, is this a main dish or is it a side?
I don't care what it is. It needs to be thrown out. But I know my wife's family eats it. The first time that I ever came in contact with this was at a family Thanksgiving. My wife's family is Hawaiian Chinese and Eastern European, but they passed around the jar, and man, when it got to me, they popped the lid, and no thanks. I can't eat anything that I can't get past my nose. If it won't pass the nose test, then I ain't eating it.
I need some protein, like sausage. Think of sauerkraut, right? You eat that with sausage. Do you eat kimchi with liver? I don't know.
I've just seen people just take it out of the jar and eat it.
Hot or cold?
I believe it was room temperature, I think.
Room temperature, okay.
Yeah.
The analysis drew on 9 studies conducted between 2011 and 2023 that investigated the effects of fermented kimchi in human participants. Results showed that consuming fermented kimchi was linked to improvements in fasting glucose, triglyceride, and blood pressure. Compared with control groups, participants who ate kimchi had fasting glucose reduced by 1.93 milligrams per deciliter, I think.
Sure.
That is. Triglycerides lowered by 28.88 milligrams per deciliter, and decreases in systolic and diastolic blood pressure by 3.4 millimeters of mercury. Hg is mercury, right? And 2.68 millimeters of mercury, respectively.
Okay, that's great. That's a really good number, Chung says. In clinical settings, even a reduction of 5 millimeters of mercury in systolic blood pressure is considered a meaningful improvement. So, seeing comparable reductions from a dietary intervention, not medication, is a very promising result, unquote.
The fact that kimchi reduced blood pressure was surprising, as it is high in sodium, a factor that normally contributes to high blood pressure. Quote, this suggests that other components of kimchi, such as beneficial bacteria, offset the hypertensive effect of sodium, On says.
The researchers included only studies that looked at fermented kimchi as opposed to just studying the impact of unfermented ingredients to have a consistent source for comparison.
This paper not only provides a meta-analysis of existing research on fermented kimchi, but also helps introduce this traditional Korean food to a broader scientific audience, since all the included studies were conducted in Korea among Asian populations. The results may not yet apply to other groups. Still, the work lays a foundation for future research in the U.S., where dietary habits and population diversity differ.
Quote, it would be very meaningful to conduct an intervention study in the U.S., On says. That way we could see if the findings of the meta-analysis can be generalized to more diverse populations. So my wife's family is not Korean. Like I said, Hawaiian Chinese, and they eat it. I've known Caucasian people that eat it, but I don't know how you can get it past your lips because it stinks. So it is what it is.
Maybe you put smelling salts under your nose. So
Have you ever had smelling salts?
Yeah,
Yeah, exactly. Well, that's exactly what kimchi does to you. So, but I didn't know it was just primarily a Korean delicacy.
Or staple.
I know a lot of people that eat it. So,
well, sauerkraut is fermented cabbage, so can't be that much different. Sauerkraut and brats.
No, not even close.
Yeah, sister, my wife and her sister, they swear by it. They love sauerkraut.
Yeah, well, sauerkraut has nothing on kimchi as far as the smell goes. No way.
All right. Thanks for joining us, folks. We'll see you in the afternoon.
Great topic. Take care, everyone. Thanks.